Well, thanks everyone for being here. Welcome. Happy Public Health Week. My name is Nicole. I'm one of the faculty members in the School of Public and Population Health, and it's my honor to be here tonight. I'm going to introduce our 4 panelists, and then we have some questions for you, and then we'll open it up to the folks that are here, as well as those that are joining us by Zoom. So first we have on the end, Gina Pennell. She's from the Idaho Department of Health and Welfare, Bureau Chief. In rural health and primary care. So that's Gina. And we have Sarah, Division of Public Health, Health Program Specialist, and Tara Woodward, Southwest Department of Health, Program Planning and Development Specialist, and then Danny Jones, St. Luke's, Chief Operating Officer. So before we get into a couple of questions that I have, if you could just take about 30 seconds and tell us a little bit more about yourself, more specifically your educational background and your current role. So we'll start with you, Gina.
Okay, do I need a mic or that's good? How do you want me to pass it along? Okay. Thank you. Sure. So Gina Pennell, I'm currently the Bureau Chief with the Bureau of Rural Health and Primary Care at the Division of Public Health. I've been in that role almost 2 years. I started my professional career with a Bachelor of Arts in Therapeutic Recreation and graduated in 2004. And I worked in long-term care in that realm for about 10 years and then moved over to public health, some experience with the Division of Medicaid, with a local public health district. I worked with a child nutrition program at the school, at the education department, and then moved over to state public health 2 years ago. And that's me. I'll pass it to Sarah.
Hi, everyone. My name is Sarah Buchanan. I am a health program specialist with the drug overdose prevention program within the Idaho Department of Health and Welfare. I received my bachelor's and master's degree in public health here from Boise State. So go Broncos. And upon graduating from my bachelor's degree, I started working for the state health department. It's been real joy working with stakeholders across the state, working with tribes, first responders, healthcare providers. That's me.
Hi, my name's Tara Woodward, and I work at Southwest District Health, and I coordinate a grant called the Partnerships for Success Grant, which is a direct federal grant from SAMHSA, and it's focused on preventing youth alcohol, marijuana, and stimulant use. And so I get to work with a lot of communities on some really neat stuff to support young people. And I have a master's in public health from Boise State.
Thank you. So I'm Danny Jones. I'm Chief Operating Officer at St. Luke's Health Partners, which is a clinically and financially integrated network that's wholly owned by St. Luke's Health System. And so we serve probably about 275,000 beneficiaries across the state of Idaho. And we do population health and essentially are a risk-bearing entity doing value-based care, which is so many buzzwords all combined into a sentence, but lots more about that. My background, I have a bachelor's degree in psychology from Idaho State University and then a master's degree in mental health counseling. I actually worked in healthcare all through my undergrad and graduate school. And then I kind of shifted gears and worked for about 7 years on the managed care side of things, Blue Cross of Idaho. And so this role really kind of culminates all of those educational and occupational experiences into what I feel like is a great lens on population health. So I'm happy to be here.
Well, thank you all. Danny, if you want to just hold on to that. I have some panel questions here and then some questions that came in from students prior to today's panel. I will ask those questions and then I certainly want to turn it over to the students that are here as well as those that are on Zoom. And if I'm walking behind you, it's because I'm trying to get the camera to move so that the folks on Zoom can see you. So I just kind of wanted to set that precedent for you all. So you told us a little bit about your degree path and the current position that you have working in public health here in Boise or for the state of Idaho. Can you tell us a little bit about, based on your education and your schooling, what was the first job that you had in public health and how did you get started coming out as with a Bachelor of Science or a graduate degree in public health? So how do you get that first job? if you're looking specifically for a career in public health.
I can start. I probably am the worst one to speak to this though, because I've never actually had something directly in public health. And mine was such a twisted path, right? It was not very direct to get where I am because it was experience in healthcare. Occupationally, I really thought I was going to do pre-med. So I kind of started down the path of biological sciences, shifted gears, went to psychology, ended up getting that master's in mental health counseling. And it was really just all of these things together that I found a really nice, like I said, just a culmination of all of my interests and all of these experiences into something that was really, I think, up and coming. And so having the opportunity to literally train, we use this term a lot, right? Like building the plane as we fly it. But a lot of the work that I was doing, particularly as I was at Blue Cross of Idaho, was really a time of great change and transformation. So healthcare reform was coming about. One of my last roles at Blue Cross of Idaho was helping to develop the products that would be sold on the exchanges. So for the Affordable Care Act or for Obamacare, that would look more attractive to consumers because they were less costly and, really were intended to provide a better, more coordinated experience at that lower cost. And so having that training on the inside of things and then really looking at, where we needed to go from, a population health and a healthcare perspective in lowering the cost of care because we know it's not sustainable. It was just a really good place for me to sort of land. So again, a very indirect path, but it was just every step of the way, there were parts and pieces that really, really interested me, that really, really sang to me. And so pulling on each of those things and then allowing that to sort of guide where I ended up. And it does actually turn out that all of those things really are very helpful and very useful in terms of the lens that I have in my work at St. Luke's. Yep.
Thank you. So I actually have an undergraduate degree in Parks, Recreation, and Tourism. So I started my professional career kind of working some seasonal recreation-based job in the ski industry and like summer camp action sports industry. And then I pivoted to working in the world of apparel. And then and then I started learning about public health and decided that I wanted to go back to school. So I worked for a little bit and then came back to school and came in. My first job in public health was actually as a graduate assistant at Bronco Fit here at Boise State. So while I got my MPH, so that was really incredible experience to get to work with the wellness program there. And I learned that some of my work in the recreation field actually was a little public health related. So that was cool for that to come full circle. And then as far as after Boise State, once I got my master's, while I was here, I chose to write a thesis and got to learn a little bit about youth development and the things in the environment that shape youth decisions and the way that things happen in communities. So those risk and protective factors that influence behavior. And it just so happened that a very related opportunity opened up at Southwest District Health as I was graduating. So I was very fortunate to kind of get that referral over there. And I am very much enjoying that. So yeah.
Sarah?
Yeah, I think for me, I got my current position right out of the gate and after getting my bachelor's, and I really, in reflecting on that experience, I think that really boiled down to learning how to sell myself for and really pulling from different experiences, sort of as what Tara was saying. I was a peer health educator for the wellness program here on campus, and interventions, public health interventions operated on a significantly smaller level, but learning how to really frame that, as well as any coursework that was applicable, any other internship experience, and really trying to promote yourself as a valuable candidate for the organization, was probably the only reason I was able to move forward in the role that I have. So I would just say, I would encourage you all to kind of consider taking a deep dive into what you have done, and really recognizing that as valuable for whatever path you're hoping to go down, and trying to really frame that in a way that will seem attractive to your future employers.
Well, I feel like a terrible panelist because I didn't actually answer the first question fully, which is I do have a master's in public health from Idaho State University, so I'm not a Bronco yet at this point, but I will be in August. But so I'm a Bengal, and my circumstances were 10 years in long-term care, recognizing that I really appreciated and loved that work, and at the time thought about the choices that those individuals had made that put them in a long-term care setting for many individuals. And then learning through the public health program that many of them were environmental and social determinants of health and things that were outside of those individuals' control. And so when I graduated with my MPH, I had just had my first child and was looking for part-time work. And so that is very hard to find in the public sector and probably even in the private sector. And so the options were limited for me. But I landed a job as a medical home coordinator for the Division of Medicaid. And with that work, we had a grant in partnership with the state of Utah to implement patient-centered medical home. And if you're not familiar with that, I encourage you to take a chance to look into that, and really looking at population health, bringing that into the clinical setting. Clinical providers, it's very new to them to shift to this model. And so I saw that in a unique role, working for state government and being integrated into private practice was unlike any experience I'd ever heard from any other panelists before. And so it was unique for me to be there, and I can't untangle from it. In fact, I moved to the SHIP grant at the local health district. And I don't need to give you my life story, but I would just indicate to you and encourage you that where you do have interests, like start having conversations with those entities, start learning about their organizations, making sure that the mission is aligned with something that is aligned with what you value. Job shadowing, things of that nature that can get you integrated into the work, and also have an opportunity to talk to the mentors that you may wish to be someday, are great ways to begin.
If I don't. Okay, excellent. So that's a great segue into a mentor question that I have, but first, one of the questions that came up, if you were an employer, what would stand out on a CV or a resume that would make our applicants the best candidate for you? So in other words, what skills and tools are you looking for in new graduates that might be joining your team? What stands out on a resume?
Well, I have some built-in biases, and I'm going to just be very explicit with them. So if you're an Idahoan, you already win in my book for wanting to stay in the community in which you grew up in or wish to stay in. So even if you're not from here and you desire to stay here, is that a decision-making factor? Not always, but it does come into play in conversation. That's outside of your control, but you are a student at BSU, so that gives you, a better sense of moving up the list compared to getting an applicant from West Virginia applying for the same job. It really depends on the position in which you're applying for. So some of the positions at the state, and I can say this because I'm actively hiring a health program manager, require experience. They want a bachelor's or master's degree, but experience is it's a minimum qualification. And so however you can get that experience, I would encourage you to do so. It does not say it needs to be paid experience. It can be internships. It can be volunteer experience. It does not say paid 2-year full-time, it's open-ended. And so I say that twofold, knowing that it's a requirement for some positions, and also it's going to help you understand what resonates with you. And you may think, oh, I want to go down the maternal child health route and then internship at a position like that and think this is not for me, so getting your toes in the water. I think collaboration, any opportunities to point out collaborations that you do, and I know there's projects and things like that that you do at universities, would be something. Every student who graduates is going to have the same curriculum for the most part that you do. So that has never stood out to me. Kind of emphasizing that curriculum, knowing that you've taken it is great, but if you have that degree, we're already going to have that kind of checkbox out there. And for me, it's the interview piece. So what you look like on paper is less important than what you show up on the screen or in person. And looking for someone who's adaptable, personable, and can talk about challenges. They don't have to be work challenges. They can be school challenges. How did you handle multiple projects at one time? How did you handle difficult situations? Like that's the day in, day out work of public health and healthcare. And so we want to see that, that you've applied that.
Yeah, I would echo everything that Gina says. And I have had less experience in the hiring process, but just some additional thoughts that are coming to mind is really knowing some of the foundational public health pieces that are needed within any position, whether it be in the research analyst, the epi department, you're implementing interventions. So knowing the principles of public health and things like social determinants of health and adverse childhood experiences, how to address these wicked problems. I will also say on a more concrete level, for positions like myself, things like grant writing and grant management are huge at the state and even at the local levels. Public health is largely grant funded. And so knowing how to apply and manage those are great skills. That doesn't, if you're fresh out of school, you may not have that experience yet, but if you have the opportunity to take coursework or intern places that are managed or funded through grants, that's another potential way to sell yourself and your experiences. So, and then I think the third thing that is shared across my team is really trying to find people who are team players and willing to learn. Since you all are active students right now, it's no question that you're seeking out education to better yourselves in your future. And so, but trying to emphasize that within potential workplace is something that may be of importance.
I think everything that's already been said, of course. And then in addition, just some thoughts. The team that I'm a part of, or at Southwest District Health, I've been fortunate to get to sit on lots of interview or hiring committees for different positions, both within our team and then in other folks that I work with regularly. So I get to see a lot of resumes and get to talk to a lot of people, which is awesome. I think when you're developing a resume, it's always great to I think it's helpful to make sure that you're curating your resume to the job that you're applying to always. So all experience can be relevant, but you want to make sure that you're really highlighting what you've done that's most relevant to that position. So I think that's always a good thing to do. And I think you have some awesome resources here at Boise State to help you out with those resumes. So that I think I used when I was finishing. So I'd highly recommend that. Writing a strong cover letter, of course, demonstrating your interest in the position and that relevancy. And then when it comes to that interview process, making sure that you're prepped. A lot of the times the questions that are asked, they'll be curated to, like the mission and vision and things like that. So do your research and come prepped and have examples of your hard work and your diversity of skills to share with that employer. And then also just demonstrating your curiosity and interest. So I'd encourage you to apply to things that do interest you. Work is a lot of, you spend most of your hours at work. So you want to do something that you can be proud of. So yeah.
Yeah, thank you. All really great suggestions. I thought I might not have much to say, but I think I do have some additional things to add. So somebody who did a lot of hiring in my various roles, especially during the pandemic and experiencing the great resignation in healthcare, there was a lot of turnover and it was a really hard time to find good talent. And so there was just this churn. And so I found myself really, really busy and hiring a lot. So as multiple resumes and things are coming through, for me, I was never one that felt like a resume had to be one page, right? I'm good with going through multiple pages, but when you're looking for something that grabs you immediately, I, like many others have said, it's the interview for me that's really going to clinch it. But to get to that point, I need something that's going to grab me, that's going to compel me on the resume. And so while it seems somewhat superficial, I pay attention to formatting. I pay attention to detail, spelling, grammar, like all of these things, right? Because if it's clean and it's easy to read and like the most pertinent points are really called out, then that's going to catch my eye. And then immediately, I can see the experiences and the things that I'm going to go ahead and allow me to sort of reach out and go to that next step. Cover letters, great. But again, concise, because I would just find myself having to go through so many that it was just like, I need something that's going to quickly catch my eye, make the point, and then just quickly sell me. So I don't know if that's helpful, but just some of those kind of superficial things that for me really got you to the next stage. I think the work that we do in general requires some kind of a calling. And so I will try to look for direct or applied experience first, but I will look at other things that can be translated, right? So if you're in a customer service industry or, anything where you interact with people or, you have the ability to manage up and manage down, communicate well, it's really those people who are interested, I think, in doing something that is part of a greater whole, right? Like you want to be part of something bigger, something greater, something bigger than yourself. And those are some of the things that I look for. So you may not have done everything that we do. And believe me when I say, with this industry being constantly evolving and changing and moving towards population health and, governmental regulations are constantly changing. I mean, it is constantly changing. So it's hard to find people who have done exactly what you might need them to do in the role. But as long as you have adaptable experience and you can demonstrate that you have grit and tenacity and that you're willing to dig in and do the time and that you're passionate about this, that to me is what I'm looking for. So I will hire over, fit over, other more structural pieces for sure.
Okay, one more question. Oh, yes, let's open it up. Please do. Yes.
I just was wondering, you had mentioned that you prefer complicated, you had mentioned that experience is like a requirement in the qualification. Are there other, in addition to working for the common good, are there other components of experience that you look for? Are you especially in experience with implementing intervention? Something like that.
I don't know if mine is maybe specific to an intervention per se. A lot of who I am hiring for will interact a lot with medical providers and their support staff who can be clinical and non-clinical in some cases. And so for me, they may not have done exactly, the work that I'm hiring for, but if they've been a medical assistant, they've worked with physicians or they've been in a clinic setting or those kinds of things, those are all very applicable things. And I think they understand the basic business and certainly being able to communicate with, physician levels, and then also with your patients, right? That demonstrates a really good, depth and breadth of, the ability to communicate. And I always just try to sense for how good is somebody at relationship building, because our industry has to engender a lot of trust. And whether that is with, with patients or consumers or members or whatever we want to call them, and then also demonstrating that you have, skill, capacity, and are trustworthy to those that you'll work with, at higher levels. All of that relationship building is just so key for me. So I'll try to sort of tap into anywhere where I can read into that. But
I, at the state level, we have job classifications that specify what needs to happen. So for example, the health program manager has to have a bachelor's in 4 years experience or a master's in 2 years experience. However, I can interpret what experience means. So what I need applicants to do is show me on paper how they have met those years of experience, whether it be volunteer work or, so I don't know if it's a specific intervention or program or grant development, whatever that might be. And recently I had an applicant, which I think is maybe a tip for you, and I've never seen this before, is they had their resume and then they listed out the kind of core competencies and core requirements that I was looking for in the candidate. And they told me how they met those in bullet points. So like program planning and development, it wasn't public health related, but it didn't need to be. They just told me how they did it in customer service or whatever it might be. So that made it very easy for someone who has to review many applications to say, I need more time with this person. So that was really helpful. Yes.
Are there any other questions or joining us by Zoom? Feel free to chime in. Danny, you had mentioned population health. So a lot of our students are getting either a degree, a bachelor's of science in public health or a bachelor's of science in health studies. And so we have a lot of students that are they come from a lens of clinical practice as well as public health and thinking about health from a population perspective, looking upstream. So what I'm trying to get at with this question is, what are the jobs that you see that combine health studies and working with individuals and looking at it also from the lens of public health? So what are some of those jobs that really combine clinical and public health? And are you working with those folks? And tell us a little bit more about what that means for you. So again, our students are getting public health degrees and health studies degrees. So is there a bridge between those two degrees, and what does that look like in clinical practice? Whether you come from the lens of public health or you're at St. Al's and you're also looking at it from like a clinical perspective. Where do we bridge these two, and what does that look like in practice? Is that question clear?
clear as mud.
Yes.
I mean, I'll just give you kind of my spin on it. I don't know if it'll be the best, most definitive answer, but I think there is a way to kind of blend that. But I will say for me and a lot of the people that I work with in our organization who are more population health focused, a lot of times they'll start out in a clinical role. They'll be doing direct patient care, or they'll be doing, social work or counseling or whatever it is. And then when they move over to the roles that we have in a population health-based organization, you do kind of evolve to that mindset of, okay, how do we adapt some of the things that, we learned working with individuals, and then now developing programs and interventions that are going to help the masses, so to speak. And how do we start to customize those things to help, people based on, attributes or, specific illnesses or chronic conditions and those kinds of things. And so I do think, generally speaking, rather than being in that sort of direct patient or member care mindset, you do shift to more of a mindset of managing a population or a community or whatever term you want to add to that. We do have positions that still do direct sort of interaction with patients or members. Those are usually care managers, but in a lot of ways, they're more centralized as a care team member, right? So they're additive to their primary care provider or, the care coordinator within a clinic or, those things. And so as we talk about that patient-centered medical home model, there are pieces to that care team that can be more centralized and serve many, because we can have a care manager who's going to reach out telephonically and say, hey, we saw that you were just discharged from the hospital and we want to make sure that everything's okay. And we need to reconcile your medications to make sure that you understand what you're supposed to continue taking, what you're supposed to stop taking. We want to make sure that everything's okay. If you're at a fall risk, have you removed the rugs from your house so that you won't trip on those? Anything that will try and keep them out of the hospital for the next time. And so there are those things that are still direct patient facing, but that care manager doesn't necessarily have just a one-to-one relationship, right? They have one-to-many because they're serving a lot of people because they're just additive to that care team. So I don't know if that provides kind of, a lens on that, but I would say generally speaking, and myself included, right? I mean, moving from a counselor mindset of, helping someone 50 minutes, once a week to sort of feeling like, oh, rather than only, helping however many people I can, maybe for 7 hours a day, 5 days a week, I can help thousands of people if we start to develop programs that are adaptable to populations and communities. So.
Well, I won't be as eloquent. But I was just kind of thinking, for this group, we three of us on this panel are government employees, working at the state and local level, public health departments, and then we have representation from a hospital. But there are many other settings that you can apply public health to. I think nonprofits is one that could potentially kind of bridge the public health and health studies that direct care and population health. We're thinking about Idaho organizations like the Food Bank or the Heart Association. Maybe there's an opportunity to apply your learnings there. So I think in thinking about that, and then also at health districts, they have clinics. And so I think there's plenty of opportunity if you really kind of start to get creative and where you think you can apply your education and experiences to bridge those gaps.
Well, the only thing that comes to mind in addition to what's already been said is we need those bridgers out there, because clinically speaking, which I'm not clinical at all, just can't necessarily say that, there's a lack of understanding of population health. And we work with rural health clinics and critical access hospitals. There's 50 rural health clinics across the state and 27 critical access hospitals, and they have opportunities to grow in this area. So to have students be the teacher for them is so important. So as much as you need to place them in roles, or they need to find roles that fit, find any role that resonates, and then educate, use your passion and your knowledge to share with new team members. And you'll see when you move into work settings, and this isn't always true, but the longer someone's been there, the harder it is for them to change the way that they practice medicine or the way they deliver care. And so the more that you can share your knowledge and inform them about the purposes and the intention and the potential outcomes of that, the better that the community will be around you, whether it's through direct patient care or through population health.
So really quickly, you mentioned population health, just to ensure that we're all speaking the same language in one sentence. Can you tell us what you mean by that? Can I give it to like on here?
This is such a good question, and it is a buzzword for sure. I would say for us at St. Luke's Health Partners, and I would say for many others as well, It is really looking at the population, which can vary, right? I mean, that can be your entire, we'll call it like a book of business. We contract with payers to manage certain populations of their members or patients. And so we can, categorize those into smaller populations or the more global or aggregate population. So when we talk about those, it's really looking at them collectively and understanding what their needs are, and then helping by adding the resources to help address those needs and improving their overall health and well-being or their clinical outcomes, if it were. So that's essentially how we look at it. And we, of course, have to have a data-driven approach for that. And so a lot of what we do is really collecting that data so that we understand what those needs are, because these aren't people that are necessarily always coming into clinics. They might not be receiving care because they have financial barriers to receiving care. They may not be English speaking, and it might be very difficult for them to come into clinics because, they don't really understand how to access care. Culturally, there might be some barriers, right? So there are all these things where those populations of folks are still ours to manage, and it's incumbent on us to try and figure out who they are and what they need. And that's challenging because our healthcare data is messy enough. But now we do have the ability to pull in a lot of other data sources that can be census information, consumer information, a lot of this stuff, and it can be blinded and all of these things. But we start to have that artificial intelligence to tell us who might live in food deserts, right? So who might not have access to good, healthy food, who might not have access to good transportation. And in Idaho, we have a lot of rural areas that we don't have good public transportation. And so they may not be able to make it in for appointments. So those are some of the things that we look at to really understand who that population is, to make sure that we can impact their health and their outcomes. A long sentence.
That's from the St. Luke's clinical lens perspective. So from one of the three of you, do you want to just share what you mean by population health?
I didn't answer the question originally, but I can share that. So from a local public health perspective, I think our lens of population health is the health of the communities that we serve. So we try, or all of our work is focused on serving the health needs of that population specifically. So our goal is to understand those, look at the data that supports that, talk to community members. Our community health team actually facilitates county-based, community-led community health action teams. So we get together local community members. We are a facilitator of those conversations, and we ask them what's important to them and how we can help support them in identifying those needs, and then making plans to address those needs. So I facilitate the chat in Adams County. So yesterday I was up in New Meadows facilitating a conversation with them, and they want to work on mental health in their community. And so we have data to substantiate that, both like qualitative and quantitative. But so, in that sense, population health is understanding what they need and figuring out how to support them, either whether that's them doing the work or us helping to find a grant to support that work and getting it out there to them. So I think population health is understanding that for us, the counties that we serve and those distinct populations that are very different in each county, and understanding how to help them have better health outcomes that they want.
Any questions from, Oliver?
So some of the roles that I looked at and interviewed, it seemed like I've been told this is the job, this is how we do it, or this is how we've done it in the past. And I'm wondering where each of you or any of you have been able to be what we would consider innovative in your role, or creative, or even risk-taking, and where have you met challenges in that approach, and where has there been rewards?
I can give an example. I'll hold on to this. So when I started my job, we already had a grant in place. We were receiving a sub-grant from the Idaho Office of Drug Policy to implement a grant. A lot of times you'll have you could have pretty specific guidance on exactly what you're supposed to do to coordinate and implement a grant, or it could be kind of loose. So, well, loose isn't the right term, but you can kind of choose what's relevant and possible to you. We have excellent leadership at our division who understands that we want to do what's best for the community. And so there's flexibility in that. Grants also end. So your funding ends. And so when that ends, that's both a challenge and an opportunity. And so there is, while funding and resources are limited, there is also tons of resources and funding out there. So when that ended, that gives you a new opportunity to look for exactly what you want to do and write for exactly what you want to do. And we were really fortunate to identify another grant and get funded to do the work that we wanted to do. So I think sometimes you can come into a position and there are very specific things that you start with, but then as you learn your population and things change when funding changes, oftentimes public health leadership is supportive of doing what's best for the community. And I think there's a lot of room for creativity, even when things are very specific.
Yeah, that's a great question. I feel like I was pretty lucky when I stepped into my current role. It was a relatively newer program, and so there was a lot of room for creativity, which was great. It was really exciting to be able to, and nerve-wracking to be able to do things for the first time. What I would say, for example, our program does some work with EMS agencies across the state, utilizing them as a key stakeholder in increasing access to overdose prevention resources such as naloxone, educational materials, providing follow-up and recovery navigation. And that was a new concept in this state, to my knowledge. And so a lot of what I did in preparation for launching these programs is researching what others are doing. I think I'm a firm believer that all great artists steal. And so use your resources and look to see what other local communities, what other states are doing, reach out, have conversations. I very much agree with Tara's point about incremental change, and innovation won't happen overnight. And so, if you are assigned tasks, completing those tasks, but also trying to learn what else can be done to further support the needs of the communities. And I think that also comes back to, Tara was talking a lot about evaluation and working with your populations to understand what they need. And I think going through those evaluation steps and taking time to reassess every so often, however, years or months or however, is also a worthwhile opportunity to identify needs for innovation or at least change.
Well, it's an excellent question that you posed. And in the last 12 years, I would say that it's changed a lot on the ability for, at least speaking for state and local government, to take risks, like use your federal dollars, do your programming, and be done. So that is not how I entered the field. So it feels very different in this day and time. And I don't want that to be a discouragement, because I think there's opportunities for innovation. There's also rules and regulations and statutory pieces that fall into place. Community partners are incredible assets because they are not tied to the legislature. So if you can funnel funding to them and work outside of, that's where I think the creativity exists, is instead of maybe us implementing the program where we historically have done that, we look to do that in different ways. But it does still exist. You just maybe have to think about the potential consequences, like in weighing those. And I would also say it's fluctuated with the ability, the trust within the organization and the autonomy that you have, and that's built over time, and demonstrating that you can meet the deliverables and meet the expectations. And then once those are done and kind of, built your case, then you can move on to some of the innovative pieces. Tends to fare pretty well.
Any other questions from those of you that are here? So we have a question from a student online, and it looks like they are an X-ray technologist working towards work in public health. So this kind of goes back to my question of students who have clinical, hands-on, one-to-one experience, but are also interested in working in public health. How do they use that prior experience as a technologist working in clinical practice and translate that? Or how do they communicate? Or do they need to even talk about those skills working in clinical practice if they're interested in moving towards public health? Maybe if we could just have one or two of you address that. Danny, if you want to speak to that, or if others want to speak to that as well. But again, this is really our student who has experience working in clinical practice as a technologist or working at the front desk of the ER, that they want to go into public health. How do they translate those skills, and what do they say when they're selling themselves in their CV and their resume?
I have a quick answer. Well, one, this person can get a job anywhere they want in Idaho. Yes, there's a lack of X-ray technologists. But I would look at the core competencies of public health and then tie your daily work directly to those core competencies and how you're helping achieve those. That's my short answer.
Andy, do you have anything else to add?
I don't know that I have anything that is mind blowing, but I would say it just depends, I think, on the career in public health, because I think, again, there's a lot that's really going to be relevant in terms of direct patient care. Especially if it's a role where, if you're dealing at all with electronic health records and things like that, it may not be directly applicable, but I mean, if you've been in the system and you've navigated it and you understand a patient chart, or, even if you've seen anything on the billing side of things, you'd be amazed at how applicable that is when you're looking at, claims data and other data sources in healthcare. So, I mean, I agree with Jeannie. I mean, you just have to kind of look at what the core competencies are of that particular role, and then take whatever it is that you're applying in your current position, and then see if you can adapt it. Yep.
Another question that was brought up, the importance of internships and mentorship. Where do students find internships, and how do they develop relationships with their mentors? So I'll break that down. First, around mentorship. How important is it, and where do students find mentors, and how do they reach out to them?
I mean, I guess I can start on the mentor side of things, because I do feel like, as twisted as my path was to get where I am, I will say every step of the way, I did have somebody who really, I think, believed in me, believed in what I was capable of. And even if I was in roles that had maybe a specific scope of work, they were willing to entrust me with additional responsibilities, just to sort of test and see how I did. And when I did well and I was able to accomplish things, right, then it was give a little more, trust a little bit more. And then they were really my advocate for, when there was another position open, or a promotion, or, as a reference, to move on in a different organization. And so I do think that it's key. I will say sometimes they come in different forms than what you really expect. And so it might not be the person who's in, your dream job or something like that, but finding good advocates who will help to sort of, just lift you up when you need it, and help to be your advocate to the next great thing, is what I sort of see as a good mentor.
I think I would say just not just talk to. It's not that easy. Easier said than done. But talk to people that are doing things that are interesting to you. And that might not be like in a formal mentorship situation, but just expressing interest and learning more about things, I think, is really helpful. Lean into those curiosities. And yeah, I think if you have a supervisor or coworkers in the current role that you're in, regardless of what that is, or if that's, where you want to stay, like Danny was talking about, show that you can, that you're responsible, that you can do the work that you're doing, and I don't talk to them about your interests. I think people oftentimes want to see you grow regardless of whether it's with them or not. So I think being open and hardworking and curious can go a long way. So.
Yeah, I think I would agree with everything that's been said. Probably the only thing I would add, and quick plug to the school public and population health. I mean, use your professors as another springboard to connect with people. It very well could be that you are reaching out to individuals who you don't know yet, but are interested in learning about their position or role, and that could blossom into a mentorship, or it will just be a cup of coffee and you learn something new. And so I think that would be my only other thing to add is work with your professors to see what are some potential paths you'd like to go down and what connections they have to potentially help you get there.
The great suggestions, I would say also looking at some local conferences that are happening. So for example, the Idaho Health Priorities Conference is happening the end of May here in Boise. You could just Google Idaho Health Priorities Conference and it will show up. There'll be opportunities to learn about different topics, meet new people, networking is the way to do it. There are other opportunities outside of that. I know there's healthcare conferences and, specific conferences for clinical professions. I feel like I have mentored a lot of folks, but I've never had someone ask me, will you be my mentor? And I feel like that's how it works, is that you're just there for them, you support them, you coach them, you help them grow. At the Division of Public Health, quickly to talk about internships, we have formed a relationship with the School of Population and Public Health, the academic health department. And so we're working to formalize what that looks like. And so that you don't just have to, it used to be you just had to know Dr. Taves and then she would connect you with someone. And it kind of still is that way. I know she is. That's why I said that. And now it's like you have to know Mac because now Mac's my contact. But we're working to formalize that because it's not easy for the university or for us to do that. And honestly, just sending all public official emails are public, right? So send an email and I'd love to have coffee. Look at the websites that are on local public health departments and state health departments and find something that interests you. And if you reached out to anyone and asked, can we have coffee and talk about what you do? I can almost guarantee you no one's going to tell you no. And that's a great way to get started.